My name is Nina Nardello. I'm a staff physician at the Women's Center with South Shore Medical Center. I like to tell people I didn't choose OBGYN, OBGYN chose me. I actually wanted to be a pediatrician for the longest time, and then I did my first clinical rotation as an OB and did my first delivery of a baby, and I was hooked. There was no turning back, there was no thinking of anything else, and I literally just fell in love with it from the moment that I did my first delivery and haven't really looked back or regretted it, and I love what I do. One of the things that I tell expectant moms to kind of ease their concerns, one, I like to tell them that what concerns they bring to us are probably the same concerns that most women have as being either first-time moms or even subsequent pregnancies. They should bring their concerns to us so that we can talk about them and we can address them and hopefully put their minds at ease. And I like to use a lot of my own personal experiences because I think that helps them to understand that I may not have been through the same situation as them, but I have been through, I'm a mom myself and I've been through deliveries, and I can give them some insight as to some of the things that I went through and how I felt and how I coped with it. And then the other thing I always tell them is that they're at the right place. I always tell them, you didn't have to travel all the way into the city to find a place that has the neonatologist, that has the high-risk obstetricians, that has the experienced and talented OBGYNs. My philosophy really is, I think the patient should take some time beforehand to stop and think about who it is that they want to have involved. Do they want, is it going to be more of an intimate experience with them and their partner, or do they want extended family involved? I think it's important that people kind of figure out in their own minds what they're comfortable with and make that decision and let their family know. From our practice standpoint, from the hospital standpoint, we're there to support them in whatever decision they make, and whatever they choose is their choice, and we're willing to go along with it obviously within reason. I think childbirth is actually a really unique experience when it comes to cultural sensitivity because there are quite a few. A lot of cultures have very specific ways that the delivery process may happen for them that's different from what we're used to. I think it's important that patients understand that our main objective is to provide good quality care. And then, we will do our best to incorporate, obviously, any cultural traditions that they might have that pertain to childbirth, as long as obviously we can keep that main goal in mind, that our outcome is to hopefully have a happy, healthy baby and mom. It's really providing excellent care to this community. Again, having the availability of neonatologist, a level 3 NICU, having maternal fetal medicine in-house, having anesthesia and pediatrics available for deliveries. Those aren't things that all community hospitals have. So I think that's really unique. You don't have to fight the traffic to get into the city. You can stop right here and have a wonderful birth experience and know that you're getting good quality care. And that's why, when I knew that I was coming back after my training, I knew that South Shore Hospital was where I wanted to be. I love being a part of probably one of the most exciting and important parts of a woman's life. I mean, I don't know that as a woman I could say that there's anything else that's been as exciting as becoming a mom. And I get to be a part of that for so many different women. And every day I think about what an awesome experience that is and responsibility. And I think it's not everybody gets the chance to do these types of things, and I mean it's just it's really a unique thing to be able to live here, work here, get to know people on a more personal level, and I think that's a wonderful opportunity.